the Russian invasion of Ukraine happened, and there was a New York Times article speaking about, well, these are good organizations to donate to because they're honest and they're doing good work. And so I looked up one of these, International Medical Relief, IMF, and gave some money, but also was sort of saying, well, gee, they seem to be running a clinic to help displaced people. Might I volunteer for that? And so you begin the paperwork and you don't know if you're really going to go through with this and, what the reality of this is going to be. But as it turned out, it's such a well-run organization. My wife and I were comfortable that this was a safe endeavor. It was in Warsaw, so it's not in the Ukraine. And so it actually happened. And I spent a week there. It was the most clinically powerful moments of my career. It was also amongst the most frustrating moments of my career. So we're working in a center where if refugees or displaced persons made it to the Polish border, the Polish government then would receive them and brought them to sort of reception centers, and this was one of them. So it's a huge place with 1,000 cots laid out in a huge hangar-like space, and we had a medical clinic to see and take care of them. And I remember when I first got there, and you're so busy with the logistics, and you're supposed to pack your suitcase with things to bring to them. So you had these huge suitcases, and you're just dealing with logistics. And then all of a sudden, you find yourself standing there in the center, surrounded by the people you see in the news, families just laying in cots, all of their world possessions, and some of them, their pets, are right there, and that's it. And this was a center that the design was that you stay there relatively short term until you got a visa to go somewhere else. The echoes, obviously, of this being a European crisis, my family having fled Russia and Germany as refugees, I think played a role in wanting to go and in some way help people in a similar circumstance. It was overwhelming. I will say that it was difficult to see. These people had needs that went well beyond anything we can do. So it was frustrating. It was, hi, I'm here, I'm a doctor, I want to help you. And through translators, you couldn't fix the big problem, that their lives are in hell now and their lives have fallen apart. We were able to treat their coughs and colds, and probably a lot of COVID was in there too. It was clinically not very powerful, but emotionally it was very powerful. And I expressed frustration at the time that we couldn't do more to help them. And the feedback I got from experts in this area who do this for a living and, are amazing people was, your role is to play a part, is to be a part of the safety net, that they're jumping out of buildings and you're holding one corner of the net, and you're part of a group that's helping, that you are offering them hope. These people were appreciative out of proportion to reality of what we were able to do, but I'm very glad I did it. I'm not sure. It took me a while to recover, come back to my life of safety and plenty. There were two patients in particular that I have written about and carry with me. One was a young a young woman alone. Her father was fighting and in the Ukraine, and she was able to speak to him regularly, but each phone call could have been the last phone call they had. And here she is, and she spoke English. So I was, for the ones who didn't speak English, I think I was so focused on just in as few words as possible getting the current medical story that you didn't really hear the whole horror. When I saw patients who spoke English, of course, they were able to tell me much more detail about their life, and she was. And I can still see her. Nothing medically serious going on. And I took care of her. And then one of the other things I did while I was there was be with the kids. They had these like nursery areas, and I would go to be with the kids. And I go one time, and she's volunteering there. Something about that of her volunteering in the midst of her own disaster was very powerful. The other patient I carry with me is a young man, and I think it resonates with me because he was approximately the age of my two sons. He came in, also spoke English, very polite young man, came in with his mother. He was the patient, and the mother was the very picture of shell shock. It's called different things by different people, but people who've been exposed to this sort of violence just get a flat affect and they're numb. And he was being the strong one for his mother. And he came in for a cough, and I saw him once, and he came back, and he was better. And I said, can I give you more of the medicine I gave you last time? That was one of the things we did. Was we gave them medicine. It was in 17 languages, and we had to figure out what the boxes said. Thank goodness for Google Translate. But when I offered him that, he said, no, thank you. I'm okay. And I'm thinking to myself, if I was in that situation and somebody offered me anything, I would grab it just to have it. God knows what might coming next in his life. Could he use a little medicine? Maybe. So him saying, no, thank you. I must have looked shocked, because then he said, well, maybe a little cough syrup again, because I'm still coughing a little bit. I think he wanted to give me something to do. So I got him that. Him holding his mother's hand and just the inevitable comparison of his life to my son's. He was a college student. He had a bright future, and now his world has crumbled, and he's there to try and be the strong one for his mother. So that was then to add to the drama of it on the flight back. I took a Polish airline there and back for nonstop, and it was like, I guess it's fair trade, fair experience. They said everything in Polish first, so I didn't know when we were supposed to board, what we were doing. On the flight back, though, in English, they had a call for, is there a doctor on board? And so there's still, I think, infused with desperate need to do something of some good to somebody. So it was a little funny because it was a woman who got hypoxic, lack of oxygen as we went up. She had lung disease. So they had oxygen. We gave her oxygen, and the flight attendants were translating for me. Turns out she's a Polish American from New Jersey, and there was a lot of confusion. There's one point I'm speaking to the flight attendant in English, the flight attendant speaking to the patient in English, and they're going back and forth until I realized we're all speaking English. I don't need the translation. And I said no to the patient. You speak, her Polish was better than her English. So I said, I need details in Polish. So then it just was a chaotic situation. But we gave her some oxygen, and in, I guess, true American patient fashion, she absolutely refused any help on the ground. So I had to speak to the captain, and he was like, "We're going to land, and we're going to have an ambulance ready," and she didn't want any of that. So I sat with her with the oxygen and was dialing it down, because as we got down to sea level, her breathing was fine. I think I convinced her to see a doctor at some point in the next week or so, but I thought it was ironic that probably the most clear clinical benefit I did that week was on the flight home. But it's an experience I won't forget. I probably will do something along those lines again at some point. But it was something that it put a lot of things in perspective for me. And I still think of those patients.